For being on our training presentation today. What I'm going to do is I'm going to go through a short PowerPoint presentation about the system itself and the background of uPhoria and also some key elements of it. And then I'm actually going to walk you through the system that you have and really want to help you set this up for success within your practice. So the best thing to do is like you watch the training and the webinar and then do a couple treatments. And then I'd like to follow up with you to see how the training went and answer any questions you have. So what we're going to do is share the screen. It's going to be probably about a whole 30-minute presentation. So if you have any questions, there is a Q&A section on the bottom that you can click on and ask questions as I'm going through. Feel free to ask at any time, and my colleague will pop up the question. I'll answer it for you. So uPhoria, it's a noun, it's a feeling or state of intense excitement and happiness. That's exactly what we're presenting here today. It's a brand new technology that hasn't been utilized in the dental profession before, and it's something that we developed because we really saw a market demand on doing in-office whitening based on patients wanting it, and filling a void where procedures took typically an hour and a half to do in office or trays and things like that. So your patients will be elated that they can have a procedure and a service done in your dental office that they haven't been able to do before. A little bit about the development team. Dave Wucinic, he was the past director of ultrasonic research at Cavitron. He has 40 years in ultrasonic product development. He has over 35 patents granted. He is one of the gurus on ultrasonic technology, and that's what the uPhoria system is. We're utilizing ultrasound in a technology on whitening an entire arch at the same time versus utilizing light treatment. Myself, I founded Denovation 17 years ago. My primary focus was on product development in the chemistry side and worked with a lot of large consumer product companies over the years on developing products for them. And have 11 patents on whitening technologies. And really what Denovations has done is really focus on the research and development side on how to activate hydrogen peroxide in a very unique, rapid way. And that's where the uPhoria system comes in. It's a complete whitening solution. You're now able to offer your patients an immediate boost in office in under 4 minutes of treatment time. Plus, if the patient desires further results, you have an option for the take-home product as well, where they can have further results in maintenance to where they're very motivated after they just had the in-office procedure where they got a nice pop in whiteness, to where then the at-home product will motivate them to continue to do a treatment. But by no means, you could do just the in-office if your patient's satisfied with the results. But I find that if you incorporate the at-home product into this procedure, patients are very motivated and excited, and it will help drive your recall in 6 months or 3 months if they're on perio maintenance. Huge patient benefits that are unprecedented on this product. Whiter teeth in only 4 minutes. Total chair time is about 8 minutes. Zero tooth sensitivity. Both the in-office and the at-home product do not cause tooth sensitivity, which is a huge patient benefit. 100% enamel safe. The number 1 and 2 questions I got over the last 20 years on any whitening is it cause tooth sensitivity and does it hurt my enamel? And uPhoria does not. Big practice benefit, no soft tissue isolation is needed. This is how we can get this treatment time in under 8 minutes and 4 minutes of the procedure, the actual treatment time, to where there's no soft tissue isolation needed because of how we formulate the whitening serum and how it incorporates with the cavitation technology that we have. uPhoria is based on science. The process of ultrasound will produce chemical reactions with an enormous amount of energy. As you can see in the illustration here, what we're doing is we're creating these fizzing bubbles all throughout a saturated foam pad that is mounted onto the mouthpiece here. And what this does is it causes rapid activation of hydrogen peroxide. We utilize only a 12% hydrogen peroxide solution, and that allows you not to have to provide soft tissue isolation, but more importantly, it doesn't cause tooth sensitivity for the patient. This entire science, it's called sonochemistry, which is basically the formation and collapse of microbubbles. And I'll show you in this next slide of the size of these bubbles. This is a cross-section. The big circle is a cross-section of a human hair. You can see that you can fit for these microbubbles into the cross-section of this size of a human hair. And what this does is creating these micro implosions that will activate the hydrogen peroxide in a very rapid manner. Therefore, we can utilize a lower level of hydrogen peroxide and really deliver a nice whitening result. uPhoria is based on clinical evidence. The machine itself is very robust. The R&D team did a life test on this to where it'd be equivalent of 13.5 years of use. If you did 2 treatments a day for 6 days a week, that's 8,424 treatments, and the machine still kept going. So it's a very robust machine. We completely regulatory compliant. We did the FDA testing. We also designed this for European markets and did the medical device requirements called IEC 60601-1. We did risk assessment and electrical safety. So rest assured, we spent years of research and development before we launched this product. We actually launched this last June, selling it direct, and now we actually go through Henry Schein. It's a safe procedure to do. There is zero effect on the enamel hardness and no enamel erosion. We actually did a pretty unique test. Believe it or not, there's no standard test in the United States to show enamel hardness and enamel erosion. But there is one in Europe, and we actually adopted that test for here and showed that we didn't have any effect on the hard tissue. We also did a multi-site clinical evaluation of the product where we're getting 4.5 shades improvement in 4 minutes. So you get a nice pop in the whiteness, and also if you do the at-home product, you can get another 4.5 shades. So you can get a nice noticeable result for your patient. This is my favorite side. This is really where uPhoria sets itself apart from typical whitening products that you might see in office or at home, is that 80% of patients want a brighter smile. It's the #1 desired treatment. Yet only 4% elect to get either an in-office or a take-home product, leaving this huge market opportunity. And this is where uPhoria comes in. If you're doing other in-office or chair-side or at-home products, continue to do them. You probably are doing 3 to 4 a month. uPhoria is designed to be incorporated into existing dental appointments and as a gateway procedure for other cosmetic work for your practice. So you do a uPhoria treatment in office, the patient gets 4 shades whiter, and that will help motivate them to do other cosmetic procedures within your practice. The big question is, why is that 4% not 50%? Well, the disconnect is chair time. Typical other in-office products can take 25 minutes to an hour and a half. If you do trays, you send them out to the lab, or if you do trays in your practice, it still takes a certain amount of time. Also, patient and doctor costs. uPhoria is a very affordable product for the patient and for the practice. And the #1 reason is you don't have to have pain to whiten teeth anymore. So as I'll show you in this next slide, uPhoria is a new standard of care. It's an experience that you can get immediate results in office within the existing appointment. And then if you say you provide the at-home product, it provides the patient further results in maintenance. And here's the important thing of the at-home. And I'm going to walk you through the details of each of these products when I stop sharing the screen. But this will help promote your 6-month recall, where the patient is satisfied with the result they have. They want whiter teeth. So this will help drive in the emphasis of coming in for their 6-month recall appointment. uPhoria helps you grow your practice. It'll help you grow hygiene. If you do ortho, I couldn't imagine a single ortho case that the patient just had their case completed where they got their braces off that they wouldn't want a uPhoria treatment and whiten their teeth. Crown and bridge. You could do just the uPhoria in-office treatment before you prep for the crown, before you numb the patient up for crown and bridge. You can do a uPhoria treatment and give them a nice pop in their smile, to where then you could do the crown prep and match the shape, because there is no rebound effect with uPhoria. What this means, it's a practice builder that will help drive patient recall and, more importantly, delivers patient satisfaction. This is the #1 procedure that patients want. So this is where they'll be pretty happy on having a service offered in your practice that they haven't been able to do before. The uPhoria at home is a pretty unique technology itself. We have an accelerator mouth rinse, which raises the pH of the surface of the tooth and kills the bad bacteria that prohibit the release of peroxide. And then we have a patented whitening varnish, very similar to a fluoride varnish. Fluoride varnish sticks on for about 4 hours. We utilize a different type of rosin to where it stays on the tooth for about 30 minutes, creating this small layer on the tooth to where that'll allow the level of hydrogen peroxide to get into the tooth and stick on for, like I said, for about 30 minutes. And clinically, we did a clinical evaluation of this. You get 6 shades in 3 days, doesn't cause tooth sensitivity, and 100% enamel safe. Best thing for the practice, there's no strips, no trays, and no lab costs. Makes great business sense for the practice. A couple of scenarios I have a doctor in South Dakota that implemented this to drive his recall, where a typical charge was about $150 for the in-office and take home. If you charge, if you do just the in-office, obviously you set your pricing. Typically costs about, you charge about $100 for the in-office and about $50 to $60 for the at-home. So if you did a couple hygiene patients a day, this could generate $74,000 in incremental revenue in the practice, $47,000 in profit, and you get a payback on the system itself within 1 to 2 months. So there's very few pieces of equipment within the dental practice that will really deliver on incremental revenue and provide a service that patients truly want. This is some of the feedback that we get from the professionals, but a pretty interesting story here is the practice that was utilizing this for their recall to where it was existing patients that he wanted to improve upon his recall percentage. So he was utilizing the uPhoria as a marketing tool to help drive the patient and motivate them to come back in for their 6-month cleaning. We provide marketing support with your system. You should receive the patient brochures and posters. We also have social media support, but more importantly for us is we want to make sure you're thoroughly trained. So this is step 1 of the process here of showing you the system, showing you what we have, but also if you have questions as you're going through the procedure with the staff or whatnot, we certainly want to be able to provide support for you, and feel free to call our office. Our phone number is 617-737-1199. I'll follow up with your office after this training too to see if you have any questions during this. I'm going to stop sharing the screen and walk you through what the office received. And what really is the best way to do it is if you have any questions on how to put the machine together, or once you do a couple of procedures, feel free to give us a call. In your system, you should have received demo kits. So this is for you to use on yourself or staff to help you get familiarized with the actual uPhoria treatment itself. So you have 4 demo kits. You got rat cards that will help promote this. A good place to put these, obviously, in the reception area, but also in the hygiene department. uPhoria shade guide. And I'm going to go through a little bit in greater detail the actual shade guide because it's different than doing crown and bridge. Bleaching is a unique animal on shade selection and case selection for whitening. You have safety goggles. We're not utilizing lights, so they're not utilized for that. It's really for if somebody is applying one of the saturated foam pads and the 1 in a million chance they had the foam pad over the patient's eyes to where the hydrogen peroxide could drip out. Safety goggles. You also received the in-office kit, which has everything you need except the bib to do one treatment. So you have the accelerator mouth rinse, you have cheek retractors and gauze that will help protect the lips, and then you have 2 foam pads that we'll use to saturate and actually apply onto the machine itself, as well as 2 syringes of the uPhoria whitening serum. So the procedure itself is pretty straightforward. And before I jump into that, I'd like to show the technology here. And this will show you how the machine actually works and how it's a unique technology. I'm going to turn it on here. If I point it to the ceiling and I put a little water on it, you're going to see a little misting here. Let me move it to where you can see the backdrop here. You'll see the water atomize and shoot up. And that's actually the sono chemistry working right there. And you could hear a slight hiss if the liquid gets behind the metal horn. And all that means is just, it's cavitating behind the metal arch. Each system comes with 2 autoclavable mouthpieces. You simply, after each treatment, put this in your normal autoclave process. The machine itself, you can use a cavity wipe to wipe down. The mouthpiece will screw on and screw off of the ultrasonic unit itself, just like a light bulb. So when you put the mouthpiece on, you want to make sure, after you utilize after you do a treatment, there's a smooth metal finish of that. Sometimes if there's a little buildup on that from the autoclave machine or whatnot, you want to wipe that down because you want to have a complete contact with the ultrasonic unit and this metal piece here, to where if you don't, the system will air out and you won't have any cavitation. So you just simply screw it on. You don't have to over tighten it, but you'll know it's completely applied once you tighten that. This machine itself, the system elements, you have the mouthpiece, you have the ultrasonic unit, you have a plunge mechanism with the stand. So you simply push in and you could do quarter turns to give you major movements. You have the horizontal and vertical bars. This knob here, I tend not to have to loosen or tighten it once I do it once. Typically it'll stay in position, and then tighten that once and you're pretty much good to go. When I put it up to a patient, I'm turning the outer knob, letting it hang down, and then I can position it around like that and tighten it up. You really don't need to do the quarter turns or the plunge that often, because you're typically going to find where it is sitting to where it's vertical to the floor. But this outer knob, you can loosen it and move it around. It gives you the degrees of freedom to where you have it up to the patient. This is the control unit. It's a simple touch screen. The main power button is on the bottom, little black switch. Also, when it starts up, it registers 2 minutes. But after it sits idle for a few minutes, you'll see marketing messaging. So I recommend that you keep this, if it's in your hygiene room, have it plugged in, have it in the corner, and have the screen going, because it'll actually help promote the treatment within your practice, to where it'll actually show before and after. It'll talk about 4 minutes. So it's another marketing tool for your practice. And also with the poster, you can hang it in the, obviously the reception area, but also recommended to have that in your hygiene department as well. You have the stand, which has locking wheels, and it also has a 12-foot cable that should be able to accommodate any operatory that you have, and you could wheel it between operatories if you're doing a crown and bridge uPhoria treatment, or doing a uPhoria treatment before crown and bridge, or in your hygiene department. Now I'm going to walk you through just the simple elements of doing the treatment. Case selection is pretty critical. If we can show the couple slides, I want to walk through the shade guide itself. I'm going to share the screen again and walk through a couple of the slides here. An A4 to an A1 is 13 shades. So it's really not indicative of light to dark when you pull out all the tabs and order them. So if you utilize the Vita shade guide, that's what you have to do. And we find most practices don't reorder the tabs on the Vita shade guide. So we have the R20 shade guide, which is really just a directional shade guide to help the patient select the initial shade. So you could go ahead and stop sharing. I'll actually show the shade guide. It's an important marketing tool. You're not matching this for crown and bridge. For bleaching, when we do bleaching in the clinical environment, we're actually finding the center of one of the anterior teeth and really selecting a dot or a spot there to match the shade to where the tooth has multiple shades in it. So like for crown and bridge, if you're doing something, you'd probably report to the lab of different colors or shading on a particular tooth. For whitening, it's just having the patient help in the process. So what I typically do is I hand the patient a mirror, and once they sit down, I put the shade guide up, and I'm going to measure their 8 and 9, and have them help me in the process. You know, where they're engaged, and you're just trying to get a directional place of where they're starting. So, you know, if they tend to be on the yellow or brown side, you know, find a couple shades to where they're about. You know, and then same thing at the end, because you should get about 4 shades after the 4-minute treatment, which is, you know, it's definitely a little pop. And then you could do the at home to provide another, you know, 3 to 4 shades, so they can get a nice noticeable difference with the combined treatment. So once again, once the patient is sitting in the chair and they have the mirror, have them help select the shade. Once again, this is a tool that they're excited about. There's a procedure they're excited about doing because it's pain-free, and it certainly will provide the results that will make the patient happy to help them come back into the practice. But more importantly, it engages them in the entire experience. So once you have the shade selected, then what we're going to do is the simple 3-step process. I kind of walked you through what's in the kit, but we're going to have the patient rinse with half the bottle of the preconditioning rinse. This will help raise the pH of the surface of the tooth, and it's the same rinse as in the at-home, and it will kill the bad bacteria that prohibit the release of peroxide. So have them rinse with half the bottle, and then what we're going to do is protect the lips, because we don't have to do soft tissue isolation, but we certainly want to have a comfortable experience for the patient. So I have gauze in here. And the reason why we utilize the gauze versus cotton rolls is because when you have the cheek retractors in the patient's mouth, we found that the cotton rolls were just a little too bulky. So what we do is take the gauze and we roll it up like a 2x2. I'll show you here. We unfold it. We're just going to roll it up just like that. And we're going to put it in the upper and in the lower. And then we're going to apply, which also comes in the kit, Vaseline onto the lips. We're going to liberally apply Vaseline on the lips because the machine can warm up, and it will be more comfortable to wear. You know, about 10% of patients that use it, if it's used properly, might get a little white blanching on the soft tissue, which will completely go away in about 15 minutes. You're not going to have these zingers that last for 3 days like with some other high-level hydrogen peroxide material. So it's important to where, you know, we put the gauze in the upper and lower, we liberally apply the Vaseline on the lips, and then we have the cheek retractors. And then what we're going to do is take one of the foam pads in the kit, and we have 2 boluses of hydrogen peroxide. We're actually going to empty the entire hydrogen peroxide syringe into the foam pad. I usually open up the foam pad, excuse me, as a bag, and then I'll put the entire syringe into it. I'm not going to seal the bag. I'm just going to knead it to where I'm going to get full saturation of this foam pad. You want to work it up to the top to where you're getting full saturation as well. Because this is one of the critical elements of success, is having a fully saturated foam pad. Just because it looks like it's foaming up, you know, I got air bubbles in here, you'll see it foam up. Then I know it's pretty well saturated. Once it's fully saturated, I don't have my gloves on, but I'm going to do it without the hydrogen peroxide on it, because it is a oxidizing agent. It would turn my fingers white. You have it slide out. And then you'll see on the back, there's these little straps that when you're putting this on, I always reach around the back of the machine like this and push down on the actual foam pad to where it shows the strap, and then it just slides on. And you have enough of these within your demo kits where you can practice that. Do it if you, it's probably best to do it with water, and then you could do it a couple times because I'm putting it on dry on the mouthpiece, you know, it sticks a little bit. But once you put that on, you're going to have the patient align their teeth edge to edge, And this will whiten both arches at the same time. So you position it up to where the patient is, and you can tighten up the knob and turn on the machine. The machine, it's going to do two-minute treatments. And the light here is just an indicator light that it's on. You might hear a hiss during the second treatment, where that just means there's liquid behind the middle part of the horn. As I was showing you earlier, this is where the ultrasonic cavitation is coming out of, to where if you get liquid behind that, you might hear a hiss. As you heard in my demonstration of putting the water on it, you might have heard a little hiss on it. By no means is it necessary. Doesn't mean it's working better or worse. Just means that you have water or saliva or peroxide behind that middle horn. So after the first 2-minute treatment, you're going to do the same thing. The machine will stop, and then we're going to do the, usually in between when the patient's sitting there for the 2 minutes, I'm going to go ahead and prep my next plastic bag and put the second syringe of hydrogen peroxide in it and sort of knead it, and then do that again. Once that second 2-minute treatment's up, I take out the gauze, I take out the trach retractor, everything in the kit's disposable, you throw it away. And then before I do an aftershave, this is one of the most important things you could do, is give the patient a mirror, let them look at their smile. Before you do shading, before you do anything else, let the patient, look at their smile so they can give you the first reaction on how excited they are and how their entire experience. And then have the patient select the aftershave, with you, of course, and then you mark it in the chart. So within the practice, some contraindications. If somebody has tetracycline staining, the dark C shades on the Vita, those are very difficult teeth to whiten, and I wouldn't recommend utilizing uPhoria treatment. Even trays, some leading experts recommend using trays off-label, to where they wear trays for months on end. The uPhoria treatment's designed to gradually and safely whiten teeth over time, not blast the enamel on a treatment to where the patient has throbbing tooth sensitivity at night and will never come back in. This is something that, as they continually come into your practice, they're going to continue to get whiter smile, and you will notate that in the chart as well, to where there's got to be a safer way to whiten teeth, and that's why uPhoria is designed to where it's like a good diet and exercise program. Sure, I can lose 20 pounds in 2 weeks on the Hollywood South Beach smile, but that's not a safe way to do it. Same thing, if you could put 35% hydrogen peroxide on the teeth, it will whiten. It will also dehydrate and cause tooth sensitivity. But there's a better way to do it, to where if you can get a few shades each time the patient comes in the practice, they can get more at home. They'll continue to have this healthier, safer whitening experience within your practice that will help promote your practice and really a healthy white smile. So keys to success on this. One, I was mentioning shade selection, making sure the patient is engaged in the process, as well as case selection. It will whiten. The best people that experience whitening in any product are the nice yellow teeth. Some people might already be a B1 or at the top end of the shade guide. They'll still get a pop, and those people tend to want whitening in general. So case selection. Number 2 is making sure the foam pad is fully saturated. A non-saturated foam pad will not allow the cavitation to go through to the foam pad, and it will not work. You need a fully saturated foam pad in order for the cavitation and the ultrasonic energy to actually get into the foam pad. And 3, and probably one of the most important things, anything I'm saying, this is the most important thing, is when you have the ultrasonic unit up to the patient's teeth, there might be an inclination to push on the back of the ultrasonic unit, to where then you'll hear more hissing because more liquid is actually getting behind the metal horn. But what that will do is actually counterintuitive, because that will actually dehydrate parts of the foam pad. It will cause the foam pad to heat up and could cause greater discomfort for the patient. And it won't work. You just simply won't get the results. So all you need is the pressure, like you would be doing if you had a soft bristle toothbrush. You just want to have contact. You don't need to have force to where they're really pushing against the back of the ultrasonic unit. As long as you're having this nice light contact and the foam pad is touching the patient's teeth, it will work. And then it will ensure that you do not have, a foam pad that has spots that are dry. So that's the three most important things are shade selection or case selection. Number two is making sure you have a fully saturated foam pad. And number three, like I was saying, don't apply excessive force. Also, a couple of the tips and tricks, if the metal, excuse me, the mouthpiece is not fully screwed on properly, I go to turn it on, it will error on. So that's exactly what happened. It just told me that, I didn't have it fully screwed on. So you want to make sure you have contact with that. You can wipe it down, as I mentioned before, with a cabbie wipe, and you simply unscrew the mouthpiece, put it in your normal sterilization process. Usually after it comes out of the sterilization process, I wipe the back of it just to ensure that I'm going to have a nice smooth connection between the ultrasonic unit and the mouthpiece. If you have any questions, please feel free to ask me. I'll follow up with your practice again just to see. The best thing to do is do a couple of demo treatments, just to get the technique down. Worry